Hello and welcome to today's video, a topic that could drastically change the quality of life for many seniors. We're talking about vitamin B12 deficiency, a silent epidemic among older adults that often goes undetected until it's too late. If you've been feeling more tired than usual, if your memory isn't what it used to be, or if your balance seems off, this could be your body trying to tell you something important. Vitamin B12 plays a critical role in energy production, red blood cell formation, and nervous system function. Yet, millions of seniors are living with undiagnosed B12 deficiency, mistaking it for normal aging. In this video, we'll explore why seniors are most at risk, the silent symptoms, and natural solutions to restore your levels and feel energized, mentally sharp, and physically stronger again. Stay tuned because what you learn today might just protect your brain, your heart, and your independence. Why B12 is so important for seniors. Vitamin B12, also known as cobalamin, is essential for many functions in the body, but it becomes even more critical as we age. Here's why. Nerve protection. B12 helps maintain the myelin sheath, a protective covering for nerves. Without it, nerve damage can occur, leading to numbness, tingling, and even difficulty walking. Red blood cell formation. B12 helps in the creation of red blood cells. A deficiency can lead to anemia, fatigue, and weakness. Brain health. Low B12 is linked to memory loss, confusion, and increased risk of dementia. Mood regulation. It helps in the production of serotonin and dopamine, neurotransmitters that regulate mood and ward off depression. As we age, our stomachs produce less stomach acid, which is necessary to absorb B12 from food. Also, medications like proton pump inhibitors, metformin, or certain antibiotics can interfere with B12 absorption. So even if your diet is decent, your body may not be absorbing B12 efficiently. Silent signs of vitamin B12 deficiency in seniors. Most people don't realize they're B12 deficient because the symptoms are subtle, slow developing, and often mistaken for normal aging. Here are 15 silent signs that shouldn't be ignored. 1. Persistent fatigue even after a good night's sleep. 2. Memory problems, forgetting names, dates, or misplacing things. 3. Tingling or numbness, especially in the hands and feet. 4. Balance issues, feeling dizzy or off balance while walking. 5. Depression or anxiety, mood swings, irritability, or unexplained sadness. 6. Pale or jaundiced skin, a sign of anemia caused by low B12. 7. Swollen, inflamed tongue or mouth ulcers and a burning sensation. 8. Breathlessness even with minimal physical activity. 9. Rapid heartbeat due to decreased oxygen delivery. 10. Vision problems, a blurred vision or light sensitivity. 11. Poor concentration, brain fog or difficulty staying focused. 12. Muscle weakness, especially in the legs or arms. 13. Digestive problems, constipation, diarrhea, or loss of appetite. 14. Hearing issues, ringing in the ears or muffled sounds. 15. Pins and needles sensation, randomly occurring without pressure. If your loved one is experiencing multiple symptoms, it's important to consult a doctor and request a serum B12 test. Who is most at risk for B12 deficiency? While anyone can become deficient, seniors face higher risks due to several reasons. Age-related reduced absorption, use of medications like antacids, metformin, or seizure drugs, vegetarian or vegan diets, gastrointestinal issues such as gastritis, Crohn's disease, or celiac, history of weight loss surgery, excess alcohol use, seniors with diabetes or those who've had stomach or intestinal surgeries must be particularly cautious. Natural ways to increase B12 levels. If you're B12 deficient, there's good news. It's completely reversible, and there are natural ways to raise your levels and maintain them. 1. Eat B12-rich foods. Focus on beef liver and organ meat's highest natural source, eggs and dairy, tuna, salmon, sardines, and mackerel, fortified cereals, fortified plant milks, almond, soy. If you're vegetarian or vegan, you must consume fortified foods or take supplements because B12 doesn't exist in plant sources. 2. Take B12 supplements. There are different forms of supplements. Cyanocobalamin common, synthetic form, Methylcobalamin, natural and more bioavailable, especially beneficial for seniors with absorption issues. Supplements come in tablets, sublingual lozenges, nasal sprays, or B12 patches. Always check with your doctor for the right dosage, especially if you have other health conditions. 3. Get B12 injections. In severe deficiency cases or when absorption is impaired, doctors may recommend B12 shots, a fast and effective way to restore levels. Many seniors report rapid improvement in energy, mood, and focus within weeks of starting injections. Prevention and lifestyle tips. To keep your B12 levels healthy long-term, get your B12 levels tested yearly after age 60. Limit alcohol, which depletes B12. Address gut health. A healthy digestive tract helps absorb nutrients better. Avoid overuse of antacids unless necessary. If you're vegan, use daily supplements without fail. Discuss all medications with your doctor to identify any that may reduce B12. Early detection and lifestyle adjustments can prevent irreversible nerve damage and cognitive decline. Vitamin B12 deficiency is often silent, but the consequences aren't. Many seniors suffer in silence, mislabeling their symptoms as just old age. But the truth is, a simple nutrient could be the missing key to restoring vitality, clarity, and physical strength. If you suspect a deficiency, don't wait to get tested. Make dietary changes and consider supplements. Your health is worth it. And remember, the goal after 60 isn't just to live longer. It's to live stronger, sharper, and happier. If you found this video helpful, please like, share, and subscribe Timeless Truths for more senior health insights. Drop a comment below if you've ever experienced any of these symptoms, or have tips on boosting B12 naturally. We love learning from our amazing community. Stay healthy, stay sharp, and we'll see you in the next one.